Hello, everyone. Thank you very much for joining us for this community conversation. We are hosting again weekly online informational sessions about COVID variants and vaccines. We also have up-to-date information about federal, state, and UW medicine guidelines. Today, we are joined by Dr. Santiago Neme, who is the medical director at UW Medical Center Northwest, clinical associate professor of medicine in the Division of Allergy and Infectious Diseases with the UW School of Medicine. Dr. Neme, thank you so much for leading our discussion today. I'll hand it over to you.
Great, thank you all. I think we have a good number of folks. I'm going to start with some general information, and because we have a number of folks here, I would ask you that you either enter your question on the chat, or whether you want to raise your hand. That way we can follow some sort of order. And welcome. So I first wanted to share with you, as you all know, we're now in our fifth wave or surge around COVID, and this wave really is marked by the emergence of a variant called the Delta variant. As you all know, in December of last year, we were actually starting to vaccinate folks. We started with healthcare workers, and then residents of skilled nursing facilities, and then we advanced our vaccination efforts. And around June, we had greater than 70% of eligible residents of King County fully vaccinated for COVID. So the expectation was that we would continue to have control of this pandemic. However, what happened is that there was emergence of a variant called Delta, and Delta is different in many ways. One is that it's a more transmissible virus. It's more akin to chickenpox as opposed to the flu. That is, the flu, you typically per case, like if you're infected, you're typically able to give the infection to 2 other people. With chickenpox, you're able to give it to anywhere between 5 and 7 people. So again, a more transmissible virus. We also know that although the vaccines are extremely efficacious, the efficacy of the vaccines for preventing infections is slightly lower for Delta than it was in previous variants. And this is reflected in the guidance that CDC share with all of us, which is that when we were only dealing with Alpha, we knew that breakthrough infections, that is an infection that happens in someone fully vaccinated, were pretty rare. And they're still rare, but what we understood at the time was that even if you were infected, you were unlikely to transmit the virus. With Delta, we have found that at least during the beginning of the infection, the amount of virus in the person's nose is actually pretty high. And it's very similar between the vaccinated and the unvaccinated who get the infection. The good news is that although the viral load is high initially, it doesn't stay high. Why? Because we have the vaccine and we have the immune system responding to that. And that's why the duration of that high viral load is much shorter, and that means less transmission. We are fortunate to have now 3 vaccines approved in the US. We have 2 mRNA vaccines, which are the Pfizer and Moderna. There are 2 doses. But there is a 3rd dose for those who had an mRNA vaccine that's indicated for folks who are immunocompromised. Why do I say a 3rd dose and not a booster? The difference between a 3rd dose and a booster is that I speak about 3rd dose when I basically gave a group of people 2 doses that would have been effective in a person who has a normal immune system. And I expect a limited response or a reduced response in those folks. And that's why I'm giving them a 3rd dose. So basically, I didn't achieve full response in that group. I talk about booster when I've achieved that full response. However, the response wanes over time. So that's a key difference here, is that this is why we're talking about third doses as opposed to boosters. And this is a select group of patients that include folks who have had transplants, folks who have had cancer or are in the treatment, in the process of getting treatment for cancer, like actively with cancer, and folks with advanced HIV infection, that is a patient who has a CD4 count less than 200, or a person who is not on therapy. And then there are other indications, patients on Humira and other biologics, persons on steroids, high-dose steroids. So there's a long list that we can share, but basically you have to meet those criteria in order to get this third dose. And why the third dose? Because there is scientific data that showed that these folks with immunodeficiencies don't really mount the initial response as folks who are immunocompetent. So I wanted to describe a little bit, the vaccines. Unfortunately, although the King County numbers are really great in terms of vaccination, when you have a virus that's transmissible, you need a higher proportion of the population to be really vaccinated for us to get a little bit more normal, towards normalcy in terms of what we do in our social lives. And this is why it's imperative for us to continue to address these concerns, these questions that folks have that are preventing folks from getting vaccinated. One piece of information that I wanted to share is that even in the era of Delta, getting fully vaccinated means that you have an 8-fold reduction. You're 8 times less likely to be infected with COVID, and you're 25 times less likely to get severe COVID or end up in the hospital or dying from COVID. So these are real numbers. And to give you an example, today in the US, we are seeing that the hospitalizations are primarily of the unvaccinated. And I'm talking in the magnitude of greater than 90% of folks who are hospitalized with COVID, overwhelming in our healthcare system, unfortunately, are folks who have not been vaccinated. Over the past 9 months now, we've gathered so much data on the safety and the efficacy of these vaccines. They're not only highly efficacious, but they're also very, very safe. There have been very rare side effects that have been serious. And we could talk about the finding of clots in the J&J group, or the myocarditis, which is the inflammation of the heart layers for the mRNA vaccines. But these cases are extremely rare, and definitely the benefit of vaccination outweighs any risk, to the point where these vaccines are actually indicated for anyone over the age of 12 with no contraindications other than a severe anaphylactic reaction. This is a life-threatening allergic reaction to any other components of the vaccine. And fortunately, these typically happen within 15 minutes of the shot. And that's why we observe patients for 15 minutes and sometimes more. So I wanted to pause here to mainly hear about, I don't know if you want to tell us what's preventing you from getting vaccinated, what's preventing your family member from getting vaccinated, what are the concerns, because the only way we're going to tackle this is if we do this together. I also wanted to share that as of October 18th, as you know, the governor has instituted a mandate for vaccination in healthcare workers. So it is really important that all of us are fully protected. And that is, when we say fully protected, you have to have had the last dose. It has to have been for 14 days from your last dose of whichever regimen you're on. If it's J&J, it's just one dose. If it's Moderna or Pfizer, it's 2 doses. So you need to calculate that, factor that into your calculation. Now we'd like to open this for discussion. I don't know if you want to raise your hand on the chat or just ask your question on the chat, and I'll say, the governor's mandate did not include higher education institutions. Hold on. I honestly don't know about. I know that at the university. Yeah, I would have to. I'm gonna have to get back to you on that, James, because I'm not sure if this applies to all of the higher education institutions, only the state ones. But that's a good, for anybody who's an educator. It's really important to get the vaccine, so then you protect not only yourself but you protect your students. Remember that there are folks who. Oh, I'm seeing a lot of questions. Okay. There are patients, our kids younger than 12 are not protected yet. So the protection is a protection given by the adults. Okay, so let's go up. Let's go on the. Yeah, clinical fog. There's no ambiguity around clinical healthcare providers. So you will not be able to really work anywhere in the state of Washington if you do not get vaccinated for COVID, unless you have a valid medical reason, which again, it's only one, which is having had an anaphylactic reaction to a COVID vaccine or a severe side effect. And again, these are super, super rare. But in the state of Washington, you will not be able to work if you do not get vaccinated. The other potential exemption is a religious exemption. There's no longer what we call a philosophical exemption, where I basically say that I don't want to get vaccinated because I don't agree with it. Family member had an anaphylactic response. What can we do about getting the vaccine? Is there anything that works? It's a really good question. What we do is that we provide an allergy consultation, a consultation with one of our allergists in cases of adverse reactions that are severe. If it's a true anaphylactic response, it's really important to have an evaluation by an allergist. That's really important. For folks that are immunocompromised, should they wait the recommended 8 months, or should they get the booster now? Really good question. So the recommendation really, and again, let's just divide 2 things. One is the boosters and one is the 3rd dose. For immunocompromised that meet the criteria, it would be the 3rd dose that you get, and you get it 4 weeks after your 2nd dose. So anytime after 4 weeks. You don't wait the 8 months, because again, this is not the booster. The other conversation is the booster, where healthy folks who are not immunocompromised get that 8 months after their 2nd dose. Okay, so if you're immunocompromised and you meet any of those criteria for moderately to severely immunocompromised, you want to get the vaccine, the 3rd dose, 4 weeks after the 2nd dose. I came in late. Did I hear correctly that the vaccine is protecting us from Delta? Absolutely. The vaccine is slightly less efficacious around Delta. And that's why we're seeing more breakthrough infections, that is, infections in the vaccinated. But as I was mentioning, the vaccines still give us a 25-fold reduction in severe illness and hospitalization. So this is how amazingly effective these vaccines continue to be. So this is why in our ICUs right now, what we see is that more than 90% of hospitalized patients with COVID are unvaccinated. We see a small subset of patients who are severely immunocompromised and only receive 2 doses and are sick in the hospital. And that's why there's this indication for the 3rd dose. And this is why we're seeing kids for the first time in our intensive care units. Why? Because we're dealing with a virus that's a lot more transmissible. And we're unfortunately, we have many adults who haven't been vaccinated. And the only way to protect now a kid younger than 12 is by all of us to get vaccinated. Could the speaker provide an update on vaccine status for younger kids? We hope that there will be an announcement in October. Unfortunately, this cannot come soon enough, and it's not confirmed, but that's what we hope. How do I explain to family members the situation in Israel where 80% of the population was vaccinated, but they're facing another surge? Is this virus outrunning the vaccine? I think that the way to explain this is that unlike Alpha, this virus is very transmissible. So we're seeing a lot more opportunities for people to get exposures. And you will, and unfortunately, 80% of the population is not high enough. We thought that 70% was going to be our safeguard. But unfortunately, what we're seeing is that it's higher. But even if it's higher, like Iceland, close to 90%, you would still have these outbreaks. That's the story in New Zealand. That's the story in Iceland. Israel is 80%, but it's not 100%. And even if it's 100%, there's no intervention that's perfect. And this is why I feel like we need to move on from the discussion of COVID being over and done. And I think of what we need to think about, how do we control COVID better? How do we utilize all the tools that we have? Because the vaccines are really an amazing tool, but it's one of the incredible tools. We also have masking, we also have social distancing. So we will have these outbreaks that are gonna likely be generated by people who are unvaccinated. And that's what we're seeing. And even in Iceland, which is like greater than 90%, you will see these pockets. And it's invariable, it will happen because, again, there's going to be activity in this highly infectious organism. I guess the difference, what I would tell my family members is that if they want to really, really do something to really cut their chances of ending up in the hospital sick and dying from COVID, is to really get vaccinated. That's the way to do this. This is the intervention that honestly, when I got vaccinated, I never thought that the vaccines will be 100% effective and that you will never get COVID. That doesn't exist. There's nothing in medicine that works like that. But the question is this something that's going to prevent me from dying from COVID, from ending up on a ventilator? And the answer is yes, and it still does. Still does, and this is what we see clinically today. What should we be telling our patients who have had Janssen about the booster dose? Yeah, so this is a common question, and again, it's not a booster dose, it's a 3rd dose for the immunocompromised at this point. There will be a booster for all of us who were fully vaccinated, but to answer your question, it hasn't been really determined yet, but I'm sure there's going to be an announcement about Johnson & Johnson, because I believe that we're going to see that there's going to be a recommendation for an additional dose. And I wouldn't be surprised if it were an mRNA vaccine, because there's a lot of data now about mixing and matching vaccine platforms. In Europe, for instance, you have folks who have received AstraZeneca and then they get a second dose of Moderna or Pfizer. So those studies have been really, really reassuring. So it's just that with Johnson & Johnson, we have fewer data because it's been given to fewer Americans at this point. What should we tell? I have family members who say mRNA vaccine is too new, doesn't have FDA approval. In addition, it alters your DNA. How would you respond? These are very common pieces of misinformation in the media. These vaccines do not change your DNA. These vaccines basically contain a protein that looks like the virus, and then it makes your body create antibodies and T cells. So then when you encounter the real virus, you have antibodies and protection. The vaccine doesn't really enter the nucleus of the cell, so it cannot change your DNA. So that needs to be very clear. Is it new? I would argue it's new. I think the application is new, but the technology dates back probably 2 decades. So this is not a new technology. It is a new application. But remember that before SARS-CoV-2, we had SARS-1, right? SARS. And this is not an entirely new virus for us. There's been tons of research around this. So I would say, again, one thing would have been to have the question back in December when we were giving this. But today we have almost 200 million Americans who have been vaccinated. We have tons of data. We have tons of safety data. And there's really no vaccine that has induced an effect that will last months. You don't see the side effects from vaccines longer than 2 months. You typically don't see that. That's not something. When you get a vaccine, you get side effects within the first few days, within the first 3 weeks, but you don't have them. Now, COVID does give people, like 40% of people, prolonged symptoms for months. And many people have struggled with brain fog and concentration issues and nightmares and fatigue and cough for months. And this has been really, really well studied. My brother-in-law tested tested positive for COVID yesterday. He had a cough for the last week, but didn't go positive until yesterday. He has exposed my sister, friends, and grandkids under 5. When should they expect to see symptoms if acquired from him? It's variable. The problem with COVID is that it has an incubation period from 2 to 14 days. And you know that 30% of people have no symptoms, never develop symptoms. So it's going to be hard to say. I would say for those exposed, it's important to get tested, because you might find that maybe the kids are fine, maybe the adults are not. So you want to be able to separate people and isolate people accordingly. Perfect. So someone posted the link to the immunocompromised data. Perfect. I have the same situation with family members that Brian Jenkins wrote. In addition, I was told they don't want to be told what to do. Any idea how to respond to that statement? I think that it has to do with how we approach this, right? Because I don't think that we should kind of tell people to get vaccinated. I think oftentimes we need to tell them why. And I think it's important for them to hear why, as opposed to, you need to get vaccinated. Why do you need to get vaccinated? You need to get vaccinated because let's prevent you from getting sick, and let's prevent our family from getting sick. Let's do what we can to be protected. And if we don't do this together, then we're giving the virus a lot more opportunity to really continue to mutate and affect people. Does the cardiac arrest 3 months ago mean that I am immunocompromised and qualify? The list of immunocompromising conditions are listed on that website. However, there may be chronic conditions and other things that will make you qualify. So I would discuss that with your physician. But per se, having a cardiac arrest doesn't mean immunocompromised. I heard from CDC it's not safe. It's not recommended that people take aspirin before vaccination. It's not recommended to take anything. Well, like we say, prophylactically, like before you get a vaccine. Why? Because there's concern that you might change or you might reduce the inflammatory reaction that you're getting from the vaccine. I think that a lot of people debate that because there's no true data saying that you can't. But what I would say is that it's really important for folks to know that it's totally okay if I get vaccinated to take some Tylenol, take some Aleve, if I have some pain or if I have a fever. I actually had after my second dose 18 hours of chills and pain in my muscles, and I had a low-grade fever, and I took some Aleve and I felt much better, and the next day I woke up completely normal. So it's expected that you will have some side effects. The most common one is soreness in your arm. I did want to talk about a very common question that has to do with pregnancy. I would really encourage, we're seeing high rates of complications of women who are pregnant and then get COVID. Some of them die from COVID. Some of their kids die from the whole situation. So I really encourage all pregnant women to be fully vaccinated. And I would not wait. I will not defer this. It's really critical because we're seeing that COVID is really affecting pregnant women. And there's also significant data. There's a large article in the New England Journal of Medicine showing that not only the vaccines are safe for pregnant women, but also they looked at the outcomes of the babies, and they looked, oh, are malformations more common? No. Are premature birth more common? No. So none of those things are actually true based on scientific data. So if you know someone who's pregnant, it's imperative that they get completely, fully vaccinated as soon as possible. Man, we have a lot of questions. I think maybe the next one we could do we can do 45 minutes because there's a lot.
I think so. Maybe just one more question, Santiago.
Okay. Yvonne, is there a way for us to copy these questions and then try to answer them later?
I will attempt that.
Okay. Well, the other thing, you can tune in next week because we're going to have more to talk about this. Is there a difference between the booster shot recommended after 8 months and a third dose of initial vaccine? I think just the effect of a booster versus a third dose is a bit different because, again, one is because your immune system waned and the other one is because you're completing the series. The vaccine causing rheumatoid arthritis, no such data. I don't know where people are reading that, but it hasn't really been confirmed clinically or scientifically, to my knowledge. Well, we have to switch to the Spanish version of this session, but I would like to thank all of you for joining. We're gonna do these every week. We're gonna allow more time. Because I think these are dynamic times and there's going to be a lot of information and updates, but please get vaccinated as soon as possible and engage people in the conversation around getting vaccinated. Thank you so much.